Thank you very much, David. I'd like to start this afternoon by thanking all who have spoken. Dr. George, Dr. Ford, Minister Goodenedjul, Minister Cummins. I think that all of us will agree that you've had a comprehensive briefing from all this afternoon. And my task is really therefore very easy. We are not out of the woods, but we are in a better position, significantly so, than we have been for some time. And as a result, we have promised you from the beginning of this pandemic that we would approach this with the attitude of pressing gas or pressing brakes. There have been occasions when we've had to tighten down, and there are occasions when we are able to remove the restrictions. We are in that process of removing restrictions. And I will not say for us to go back to normal, because there can be no normal after COVID-19, but for us to go back to increased activity that will allow people to live and to be able to pursue their lives with vigor, but at the same time safely so, as you've heard from Dr. George and Minister Goodenedjul. Safety must be paramount, but we cannot continue to live as if we have nothing else to do besides manage COVID. As a result, the government of Barbados would have taken a decision yesterday. The Cabinet Subcommittee met with the EOC, and we have agreed that there shall be the return to work by the public service from the 1st of March, which is Tuesday. And this is a significant departure because, as you know, over the course of the last 2 years, for the most part, we've had some level of remote activity. And even though in the third quarter of 2020, we saw increased attendance back at work, once Alpha became a reality at the beginning of 2021, for the most part last year, we had remote work in the public service. It is our judgment that it is safe for persons to return fully from the 1st of March. What does that mean in real terms? That there will still be elements of flexible work. As you know, prior to the establishment of the regime for the pandemic, the social partnership had advised and the government had accepted a regime of flexible work. And what does that mean in simple terms? That those persons who will partake in flexible work must receive the consent of their head of department and their permanent secretary. But it will not be a case of all persons operating from at home, as happened in certain departments before. With respect to other aspects of activity, the Minister of Health has indicated the other changes. Minister of Tourism has indicated the changes at the airport. And with respect to weddings, we've indicated that dancing can now happen. With respect to rum shops, the prohibition that would have stopped people participating inside has now been removed. And with respect to sports, the issue is that over the course of the next few weeks, whether it is tabletop games, whether it is contact sports or non-contact sports, the consultation between the Ministry of Health and the sporting organizations will allow for certainty with respect to persons being able to get back into their activities as they so much would love to do. Let me come now to the issue of entertainment. And while permission for entertainment events must still be channeled through the National Cultural Foundation and the COVID-19 Monitoring Unit for now, the number of patrons attending an event will be dependent on the size of the venue and not just an arbitrary cap that has occurred before. That consideration of the size of the venue and roughly the ability to allow people to adhere to the 3-foot distancing rule will determine what those venue numbers will be. And of course, that will vary from venue to venue to venue. The minimum requirement for attendance will continue to be that persons be fully vaccinated or show a negative rapid test taken at least 24 hours prior to the event. We do know, however, that service providers and technical crews must be fully vaccinated and must also test negative, and that is because they have a duty of care to the persons attending the event. The big elephant in the room and the big question for all Barbadians is crop over. What happens for crop over? We are satisfied that we can have the season of emancipation and a modified crop over season, and I'm sure that all Barbadians will be happy to hear that. What does this mean in real terms? That the staging and execution of Grand Kadooment and 4-day mourning which of course would be the two events that would normally give the Ministry of Health their greatest concern. We've now agreed that we will decentralize this such that we will have at least 8 venues that will accommodate persons wanting to play Mass for 4-day mourning and for Grand Kadooment. And it means that those persons who will attend those decentralized venues will have to adhere to the same rules that persons attending fetes will adhere to over the course of the next few months. We are happy for this because we know that after 2 years of no crop over and no release, people are more than waiting for this opportunity. But as you've heard from Dr. George, we will continue to live, but safely so. We believe that if we have those 8 venues properly fenced and with the protocols that we've just announced, that we will be able to welcome not only all Barbadians here, but all of the visitors to our island who look forward to this really being one of the first, I almost said carnivals, one of the first more than a carnival type events that can happen in the region, having had, of course, to miss those that have been normally would have come in the early part of the year, like Trinidad Carnival and others. So my friends, the consultations as to the refining of the specific events will take place next week. Minister Chantal Monroe-Knight, along with the CEO of the National Cultural Foundation, Mrs. Carol Roberts-Reefer, will meet with all of the stakeholder groups to be able to refine exactly the types of events that we will have. We are satisfied, having discussed with the Ministry of Health and the COVID Monitoring Unit, that it is possible for these things to take place safely, subject, of course, to there being no intervening event that makes our situation worse. And thus far, we are reasonably satisfied that we are on the right trajectory, not just locally, but globally. But we continue to watch and continue to adhere to the principle of gas and brakes where necessary. This is a difficult time generally, and there's some who may wonder, well, what next? The truth is that the war that is broken out in Ukraine will have implications for the cost of fuel, will have implications for the cost of food, will have implications for the supply of food and for other things too, because we do not know to what extent the supply chain globally will be further disrupted. I say these things because we believe that against that backdrop, the stress of the world in which we live requires people to have a little mental break and a little mental ease. And we know now how much mental wellness means, particularly when this pressure and stress comes at us 24/7 and at 100 miles per hour. So Barbadians, we hear you, we feel you, and we believe, as we have done over the course of the last 2 years, we will allow for activities to take place once we're satisfied that there is safety. We are at the stage where we want to thank also those who have been on the front line of managing this last outbreak with Omicron. We know the pressure it has put on the persons at Harrison's Point and the other related campuses that have literally had to manage the thousands of Barbadians who became sick. We also want to thank those who helped us with the at-home programs for isolation and quarantine. And we've also made changes, as you know, to who ought to quarantine and when and how, because we recognize that you can't just be taking people out of work for 3 days in circumstances where the testing regime really matters on day 3 and not on day 1 and 2, where the level of contagion, I am told by the doctors, is not, the risk for contagion is simply not there in day 1 and day 2 after exposure. So against this backdrop, we thank Barbadians once again, truly, truly, truly. We could not come to this point. We cannot be going in this direction without the cooperation of the majority of Barbadians. We urge people to continue, those who have not taken vaccines, to please do so, and those who have taken, there's more than enough for boosters. Please get your booster. The evidence is absolutely clear that the vaccinations and the boosters do help you and protect you against severe illness. And we regret all who have passed over the course of this pandemic, but we say that we have and can continue to keep our numbers down if we continue, 1, to vaccinate and to boost vaccinations, and 2, to follow the other protocols that have been absolutely essential from day 1, and we don't tire in repeating them: the mask wearing, the hand sanitization, the social distancing where possible. And my friends, if we do all of these things, we therefore can be assured that we will be in a position to move forward. I felt that it was important to come and speak and to support the ministers and the public officers this afternoon. I haven't spoken to you on COVID for a while. I'm here to answer any questions from the media with respect to that. The heads of government meeting is next week, and the regional level, the heads will be taking stock as to where we are regionally with respect to COVID. We are still awaiting the vaccines for the 5 to 11-year-olds from Pfizer. As you know, those are specialized vaccines that are made available, and the procurement issues have not been fully resolved. We have been treating to this at a regional level through CARICOM Secretariat, and therefore next week when we meet in Belize, I believe we will be in a better position to thank everyone. I go from Belize to Ghana. The government and people of Ghana have asked me to be their special guest to address them on the 65th anniversary of their independence. As you know, Ghana was the first black country to attain independence in this world in the 20th century. And Ghana has been that country that has helped us out in this very difficult period with the pandemic, with over 100 Ghanaian nurses coming. And therefore we go not only to wish them happy independence, but to thank them from the bottom of our hearts for helping this country when we needed it most. So my friends, we are more than available to answer your questions now. David, before I hand back over to you, a little birdie told me that it is your birthday, and on behalf of the persons here, and I'm sure all of Barbados, we would wish to wish you happy birthday. Thank you.